here today. My name is Becky Spencer. I teach here in Denton in the graduate nursing program. I thought I would start by telling you my long, strange career in nursing because I always love to hear people's stories about where they've been and how they got to where they were. So I thought I might start with that because I have a really bizarre, long career in nursing and I've jumped around and done a lot of different things, which hopefully will kind of give you an idea of what your career can look like. So my undergraduate career started at the University of Cincinnati. I'm originally from Ohio. I started out with a major in biology. And after about a year or so, and meeting a couple of nursing majors, and my grandmother was a nurse, I was kind of one of those people that was like, I'm never going to go into nursing. And the writing on the wall was, this is a great career field, and it's going to land you a definite job when you graduate. So I transferred into the College of Nursing and got my degree and moved to North Carolina. So I wanted to get out of Dodge, go see someplace new, and get near the beach. So I moved to near Duke University, and I worked at Duke University Medical Center. My first job was in bone marrow transplant, and we did bone marrow transplants for children and adults on the unit that I was on. And after a couple of years, that hospital went through some major reconstruction or reorganizing of the staff, and I decided that I was going to change career paths, and I went over to the University of North Carolina. So if you know anything about Duke UNC and their rivalry, all my Duke friends said I defected. So I went over to UNC and I worked in burns, also adult and pediatric burns. And it was then that I met my husband, and we got married, and he swept me off to Houston, Texas, where I worked in pediatric intensive care. He then had another job transfer, so notice I'm following my husband around. We moved up to Dallas, and I started having children, and I worked in urgent care, and then I landed in the nursery and the NICU. So I did nursery and neonatal intensive care, and I became a lactation consultant. And shortly after that, or I'd say we were in Dallas for about 8 years, and I moved to Kansas City and got my master's degree in nursing education and started teaching. So I started teaching in Kansas City, and really, if you really want to teach in nursing and you really want to work at that level, it's best to go back and get your PhD. So I went back to school and got my PhD from the University of Kansas. That was an all-online program. We actually ended up moving back to Texas, and I completed my PhD in 2012. So now I'm teaching. I taught at Baylor University, their College of Nursing in Dallas, for 3 years in the undergraduate program. And I taught pediatrics, I taught undergraduate research, I taught health assessment, I taught skills lab. And I did actually work here during my PhD as a graduate assistant in research. And a position came open, and they called me and said, do you want to come back? And I said, yeah, I think I do. So now I'm teaching in the graduate program, the Master's in Nursing Education program, and the PhD program. If any of you can repeat that back to me, you're good. So hopefully you kind of see, you can do a lot of different things in nursing. You can completely change career paths. I started out with bone marrow transplant. 2 years later, I was working on a burn trauma unit. Oh, I forgot to mention, I was in the Air National Guard for 12 years as well, and was a flight nurse in the military there, and ran an immunization clinic my last couple of years. So lots of things that you can do in nursing. So I tend to like to call myself the jack of all trades and the master of absolutely positively nothing but breastfeeding. Because if you go and you complete your PhD and you complete it in breastfeeding, you truly can say that that's what you're in for. So I do feel like I know a little bit about a whole lot about nursing. So that's one example of a career that you can go lots of different places. If you start out in one area and you want to change to another, you really can do that. So the presentation, your adventure begins, and I want to talk a little bit about some of our history of nursing. Let's see if I can actually get mine. There we go. Anybody heard of Florence Nightingale? Yes. Florence Nightingale is who we really kind of credit our modern nursing or nursing in the United States to. She really was an amazing woman. When we think of nursing a long time ago, we tend to think of nurses as being physicians' handmaids. They essentially just did whatever the physicians told them to do. And I will tell you that nursing is very different. And oddly enough, Florence Nightingale was anything but a physician's handmaid. She was very independent. She made tremendous changes in the health of our soldiers just through clean environment and taking care of people. She was also a statistician. Some people don't know that. That's like usually not the first thing people say when they think of Florence Nightingale as a statistician. And she's actually accredited with some graphing procedures and statistical procedures that everybody uses nowadays. So Florence is pretty amazing. And then I'm just going to go through a couple of other slides of a couple of other, some of these are a little bit blurry. Mary Jane Seacole was a Jamaican-born hero of the Crimean War. She was pretty amazing. She spent her own money and wanted to become part of the British forces. And she was actually initially rejected because she was a black nurse. Clara Barton is the founder of the American Red Cross. She was also a nurse, and she worked as a nurse on the battlefields during the Civil War. There we go. Mary Eliza Mahoney was our first black professional nurse in the United States. Margaret Sanger was an early advocate of women's rights and birth control. She's the founder of what became Planned Parenthood. She was a nurse. Lavinia Dock was the superintendent of the Illinois Training School, and she actually wrote the history of nursing with Adelaide Nutting, and I've got a great quote that I'm going to read to you here in just a couple of seconds that'll give you an idea of what nursing was back in the 1800s. Jane Delano was the superintendent of the Army Nurse Corps. She died in Europe after active duty in France in World War I. Mary Breckenridge was the founder of the Frontier Nursing Service. Can you imagine getting on your horse and gathering up all your medical supplies? And she was really a pioneer in rural health and going out and seeing rural patients. Lillian Wall was the founder of the Henry Street Settlement and the New York Visiting Nurse Service. She was kind of the birth of home health nursing. She was the first visiting nurse service in the world. She actually initiated. And Linda Richards was the first trained professional nurse in the United States. She started nursing in the United States, and back in the 1800s, there were hospitals that were not very reputable, that did not give very good care. Many times the people taking care of patients were criminals or not the kind of people that you would, some hospitals were not savvy or good places to go to. There were excellent hospitals in the United States at that time as well. Interestingly enough, they were mostly run by nuns. So nursing, initially in the United States, very much looked more like the life of a nun. Linda Richards, however, had gone, Florence Nightingale moved to England, and Linda Richards went to train with her and then came back to the United States and really established some of our first training programs. She also established the first nursing training program in Japan. So if you think back to these times, we tend to think of women as not, these were amazing women pioneers. These were women that were doing things that were not routine or accepted or normal. These were women who were real pioneers for our profession. This is a quote from Linda Richards, and this gives you a little bit of a sense of what nursing was back in 1872. We rose at 5:30 a.m. and left the wards at 9 p.m. 5:30 a.m., 9 p.m. to go to our beds, which were little rooms between the wards. Each nurse took care of her ward of 6 patients, both day and night. Many a time I got up 9 times in the night. Often I did not get to sleep before the next call came. We had no evenings out and no hours for study or recreation. Every second week we were off duty one afternoon from 2 to 5 o'clock. No monthly allowance was given for 3 months. So this was nursing. Very much looked like living in a convent. Nurses didn't get married, you lived at the hospital. This really was your whole life. Nursing has changed, thank goodness. So that gives you a little history of kind of where we've come from. And now I'm going to to talk a little bit about nursing today and opportunities and things that you'll see today. The first thing I want to talk about are the professional pathways to nursing. So I'm going to kind of meld together what education you need to become a nurse and what education you need to be a certain specialty of nurse or type of nurse. The first thing I want to talk about, and I'm sure some of you, maybe some of you even kind of grappled with, do I get an associate's degree in nursing or do I get a bachelor's degree in nursing? I'll commend you all for being here because we really are moving toward wanting the bachelor's degree to be the entry to practice for nursing. But I want you to understand the difference between the two because when you're working as a nurse, you'll be working with nurses that have associate's degrees and bachelor's degrees, and many times you won't even know what the degree the nurse has that's working next to you. So I want to talk a little bit about the two degrees, what the difference is, and kind of where we're moving. So the associate's degree in nursing is typically a 2-year degree from a community college. However, it's not really a 2-year degree. There are generally about 10 credits of prerequisites that you need before you can be admitted into an associate's degree program, just like there are 40-some credits that you all have to have as prerequisites before you can be admitted into the nursing program. If you decide as an associate's degree nurse that you want to someday go on and get your bachelor's degree, there are additional prerequisites before you can even get an entry into a BSN program. So really, the ADN in nursing takes somewhere between 2 and 3 years. So it's not really an associate's degree and it's not a bachelor's degree. It's kind of somewhere in the middle. A bachelor's in nursing takes 4 years of education at a university, and most of our bachelor's in nursing programs, your first 2 years are prerequisite courses. So just exactly what you all are doing now, working on your prerequisite courses and what occur in those first 2 years. After 2 years, you'll apply to get into the College of Nursing, and then you'll have your last 2 years will be all nursing-related courses. So what's the difference? Why do we have these two different degrees? And how do we really know what the difference is? I will tell you that both practice as RNs and take the same certification exam upon graduation. Some hospitals and specialties do require you to have a BSN though, and as I go through some nursing specialties, you will, I point that out, some specialties that require you to have a bachelor's. I know Baylor hospitals in Dallas do require all of their new grads all have to have a bachelor's degree in nursing. If you want to work at a Veterans Administration hospital, all of their nurses will all have bachelor's degrees in nursing. So we're moving in that direction. However, you'll see there have been some research studies that try to say, well, bachelor's prepared nurses give better care. This is really what, and I think that's kind of the wrong focus. We're all nurses. We all have the same goals. We all have the same values and desires. I like to say that that associate's degree in nursing is just missing a few puzzle pieces. So BSN courses that you'll have that an associate's degree nurse won't have are courses in research, community nursing, which I think is going to be a much bigger field in the next few decades. Associate's degree nursing students don't get any experience in community nursing. Management and leadership, and there are some other courses as well. The other thing to keep in mind is that your bachelor's in nursing is your ticket to advanced practice, which if there was one thing that I could encourage you, one little seed that I would plant today before you leave, it's go back and get your advanced degree. Just plan it now. I'm going to get my degree, I'm going to go work in the hospital, and then we'll decide. I'm going to plant the seed today. I think the future for advanced practice nurses is going to explode. It already is. We already know that there are a lot of opportunities for nurse practitioners and nurses with advanced degrees. So plant that seed in your head now that the bachelor's is not going to be your destination. It's going to be just a part of that journey. Okay, so where will the adventure take you and how will you make history? I'm going to show this clip from the Robert Wood Johnson Foundation. The Robert Wood Johnson Foundation is a foundation that has done a lot of support financially for nurses. The only problem with YouTube, you gotta watch the ad. So did you see yourself in there? Did you? I hope so. Anything surprise you that you saw? A little bit, maybe? If I can get back to my presentation going. There we go. Okay. So what surprised you? Anything surprised you? Different career fields. Yes, ma'am.
Because whenever we think of nursing, all we see ourselves is working in the hospital, with patients. But I've never ever thought like the broad aspect and other different ways.
Very good. Yes, I'm glad you see that. Because there's places for nurses everywhere, not just in the hospital. And I think that you'll start to see, even while you're here in school, you're going to start to see that there are opportunities, lots of different opportunities for places to work. How about nurses prescribe medications and they diagnose? Who says doctors own medication, right, and own prescribing? They don't. I think particularly with the changes that we see in the healthcare arena and more and more people getting access to healthcare, we do not have the physicians or the nurse practitioners, for that matter, or the physician's assistants to meet the needs of all the people that are going to have access to healthcare. So, and there's really good research coming out showing that nurse practitioners can manage chronic health conditions, patients with chronic health conditions just as well, if not better than physicians. There's great research that's coming out that's saying nurses actually prescribe less medication and they order fewer tests. That can be a really good thing, right? So, I think there's just great opportunities for you. So that's why I said a lot of the things that you saw up here do require an advanced degree, and we're going to talk about that in a second. But that's where I said I'm going to plant that seed. And I hope that some of you saw yourself in some of those slides. And so we're going to tell you how you get there. I'm so sorry, I feel like I'm like pointing at your poor face. Okay, so let's talk about different specialties in nursing and roles in nursing, kind of where these different jobs can be seen, and a little bit about how much money you can make and where the profession's going. So, registered nurses with a BSN or an ADN. All of these places you'll find registered nurses. Community health clinics, hospitals, places we typically think of, industry, public health departments, the military, nursing homes, physicians' offices, public schools, rehabilitation centers. These are all places that hire nurses. An average salary, so this is an average starting salary, but an average salary, and the salary statistics that I'm giving you are from the Texas labor force statistics from 2013. So they're pretty current. So an average nursing salary is about $67,860. Some people make less than that, some people make more. I would say an average entry salary is somewhere probably around $50,000 if you're coming out of school as a BSN and going to work in the hospital. But there's a lot of variability with that. So let's talk about some different specialties in nursing. You could work as an operating room nurse. You can do this with an ADN or a BSN. And then I also have some other certifications that we'll talk about underneath here. One thing, the other piece that I want you to leave here with is your education never stops in nursing. You are always learning, you are always growing, things are always changing. There's a new pump, there's a new medicine, there's a new something else. You are constantly going to need to have that spirit of inquiry. So if you don't like to learn, this might not be a great profession for you because you will find that you are always learning. One of the things that is becoming very encouraged are for nurses to get certified in their specialty. So when you graduate with your bachelor's degree in nursing, you graduate as what we call a nurse generalist. So you can work in any one of some general areas of nursing. Pediatrics, labor and delivery, medical surgical nursing. There's lots of different places that you can work as a nurse generalist. But once you pick a specialty, we really are seeing our nursing organizations encouraging us to go back and get certifications. So I'm a lactation consultant, and I hold a certification. I'm an internationally board certified lactation consultant. So that requires additional courses, not in a university setting. Sometimes your hospitals will offer the courses that you need to go back and get your certification. And then you take a big national, or in my case it was an international exam, and you can add some more letters behind your name. But what it means to your patients is that you have gone and done the extra steps to become certified and a true expert in that specialty. Because in 2 years of nursing school, there is no way that we can teach you everything you need to know to be the perfect expert nurse in specialties. So the CNOR is a certified nurse in the operating room certificate. Medical surgical nursing, there is a certification for that as well. You can work as an ADN or a BSN as a medical surgical nurse. Forensic nursing, you can work as with an associate's degree or a bachelor's degree. The same certification is it's sexual assault nursing nurse examiner certification, and that is a certification that you can obtain when you are finished with your ADN or BSN. There's also a postgraduate certificate in forensic nursing that you can get, and that does require a bachelor's degree to do that. Psychiatric mental health nurse. There are specialty certifications for psych nurses as well. Technology is great when it works. I mentioned too, I'm a lactation consultant. Interesting thing about my certification is it's transdisciplinary. Physicians can be board certified lactation consultants. You don't even have to be a nurse or a doctor. Dietitians can be lactation consultants. So I really enjoy that because when I go to my national meetings, I interface with lots of different people with lots of different perspectives. We're also starting to see even undergraduate education becoming more transdisciplinary, want you to have time and experiences in learning how to work with physicians, work with dietitians, work with physical therapists. So I think that's another really important part. Come on in. Flight nursing, you do have to have a bachelor's degree. They will not hire you as a flight nurse if you don't have a bachelor's degree. Down here, there's a variety of certifications that they require for flight nursing. You're certified in emergency nursing. You're certified in flight nursing. You're certified in pediatric emergency nursing, and you're certified in transport nursing. So you want to be a flight nurse. There's lots of certifications that they will generally require that you achieve. You can be part of the emergency care team, and again, the certifications for emergency nursing apply there. A diabetic nurse specialist, that actually requires that you have a bachelor's degree in nursing, and you can become a certified diabetic nurse educator. Couldn't leave out military nursing. If you want to go into the military as a nurse, you do have to have a bachelor's degree in nursing. You either, if you are an ROTC, which I know Texas Women's does have, is anyone involved in the ROTC program at all? Some students come in on ROTC scholarships and that kind of gives you a guaranteed spot in the branch that you're brought in under. But you can also, if you're interested in going into the military, I'm sure there are recruiters on campus that you can talk to. You would then go to officer candidate school once you graduated, and then they would assign you a spot in the military. You don't always get a whole lot of choice about what your specialty is when you start out in the military, but once you're in, then you can move around and be just as ADD as I was in my career, with all different sorts of specialties. So now I want to move on and talk about some of the careers, and I mean, I just gave you a snapshot of some of the jobs that you can do or the specialties that you can work in with a bachelor's degree. That's just a few. Just try to give you some varied, some in the hospital, some out of the hospital. I want to talk a little bit now about some of the graduate programs that we have and the jobs or specialties in nursing that require you to go on to graduate school. To be a nurse anesthetist, you are working with anesthesia, and you're in the OR. You work in hospitals. The military has a lot of nurse anesthetists. Outpatient surgery centers and pain clinics are common places to see nurse anesthetists working. You do need to have a bachelor's degree in nursing, and generally they like you to have about a year to 2 years of critical care experience before you go back to school. You'll get either a master's degree in nursing or a doctorate of nursing practice. Yes.
By the time they graduate, the DMP will be required for nurses.
Yes. So I think I missed that. Let me see if I can find that slide. So I had a slide where we talked about the graduate degrees. Let's see. I wanted to talk about the graduate degrees in nursing because that has, there we go. I don't know how that one got left out. So education pathways other than the BSN or the ADN are the master's degree, the DNP, and the PhD. Typically, with a master's degree, you could go back to school and become a nurse practitioner. Family practice, midwifery, neonatal, pediatric, acute care, geriatric, and nurse anesthesia are kind of typically fall under what we consider nurse practitioners. There are a couple of other master's degree programs. A clinical nurse specialist or a clinical nurse leader. Those nurses that go back, and so you might get you might become a clinical nurse specialist in cardiology. You would stay pretty close. You'd work either with physicians who are cardiologists or you'd work in the hospital, but you stay fairly close to your patient base. But you're not working as an independent practitioner like you are as a nurse practitioner. There are also master's programs if you want to become a nurse administrator. If you want to run a hospital or work as a nurse manager, there are master's degrees for that, as well as for nursing education. If you want to go back and teach either in the hospital, hospitals hire nurse educators, as well as university settings and community college settings. The doctorate of nursing practice is fairly new. It's been around for 5 to 10 years now, and our leading organizations in nursing are very much encouraging all the schools to move to a doctorate of nursing practice In 2015, schools have to offer a doctorate of nursing practice, which will kind of replace the master's in nursing, particularly for that nurse practitioner category. What that does is it adds a year or two to your study, but you're gaining additional clinical specialization in your area, leadership skills, and you become kind of an expert in quality improvement and evidence-based practice implementation. So you're able, with that DNP degree, not only to be an expert in an area and practice, diagnose, prescribe medications, care for people, but you also become kind of a change agent. And we really need nursing voices to change how healthcare is delivered. And with this extra specialization that you get with the DNP, you really become an expert in doing that. Being able to walk into a hospital and say, you know, I don't think this process really is working well for us. We need to change it. Or, why are we constantly doing something this certain way? We don't have good outcomes. But if we do it this way, we get better patient outcomes. So you become an expert in making those kind of changes. So that's your difference between the DNP and the master's as far as a nurse practitioner is concerned. And then the PhD really is a research degree. So as a PhD nurse, you become competent in doing independent research and being a knowledge generator in your field. So at the nurse practitioner level or the clinical nurse specialist or the clinical nurse leader, you become an expert in your specialty and you become an expert in how to make change happen. At the PhD level, you really are generating the knowledge. You're doing the research that says, hey, this is a better way to do this. And then your DNP nurses are going to implement that for you. Yes?
I have a question. So if you have your bachelor's for 4 years, so you have like extra 6 years to go get your PhD.
And you know what? I'm going to give you, there's a couple of programs now. There's an RN or a BS and PhD where if you're really, you know that research is your passion and you really want to do research, you can go from a BSN to a PhD. There are programs that will do that. And that's great. So if you know that that's where you want to be, that research is just, that's it for you, you can do that.
So for the MSN to DNP, do you have to get the MSN prior to the DNP? So you can, like, straight after the bachelor's, you can go like either or.
Correct. You probably won't have as much option to get a master's degree and become a nurse practitioner. If you want to become a clinical nurse specialist, a clinical nurse leader, you want to do, actually even the administration route is going to a DNP, or if you want to become a nurse educator, those master's degrees will be available. But a DNP will be what you'll need to practice as a nurse practitioner.
So you would recommend to get the DNP then, rather than the
I
MSN?
don't think you'll have much choice. Once you graduate, if you want to go on and become a nurse practitioner, that'll be your route. Most definitely. But you'll be practicing with people out in the field that have master's degrees. So everyone that has a master's degree as a nurse practitioner will be kind of grandfathered in. So they don't have to go back to school in order to continue practicing. But when you all are done, it will be the entry practice. Does that help? Anybody else confused about that? Okay. So we talked about nurse anesthesia. This is the biggest moneymaker, really, in nursing. You want to have a big salary and don't mind sitting around and in the OR, and we laugh. We say nurse anesthetists pass gas all day. Anesthesia gas, but their average salary is about $162,000, and if you're willing to work rurally, not necessarily within cities, your salary can be much higher. But if you like the OR environment and that's your thing, nurse anesthesia is great. So nurse practitioners, we see them in clinics and community health centers, hospitals, in the military, physicians' offices. Interesting in the military, if you get your bachelor's degree in nursing, you're really interested in military, there are a lot of programs within the different branches right now that will pay for you to go back to school to become a nurse practitioner, and they'll pay for your living expenses while you do that. So there are some good opportunities within the military to go back to school. Your education education, you'll need a bachelor's degree. Again, that's your ticket into advanced practice. And 1 to 2 years in your specialty, I will tell you that that's somewhat variable. I have seen some students come right out of a bachelor's program and go right into a nurse practitioner program. You're going to hear a lot of different people give you a lot of different advice. How much experience do I need when I graduate before I can go back to school? And I'm going to tell you that that's very much an individual decision. I have seen some students that come out of their bachelor's program, and I look at them and I say, don't wait. Apply now, you're ready. And there are some people who say, and usually you know it, I think I need a little bit of experience before I go back to school. Most schools will say they want you to have at least 1 year experience before you apply. But if you think you're ready, don't let that hold you back. Go ahead and apply. The worst they can say is no. Work for a year, apply again. Your average salary for a nurse practitioner is about $102,000. I will tell you, I have a good friend who's a neonatal nurse practitioner at Parkland, and the neonatal nurse practitioners at Parkland run that unit. They are completely nurse practitioner run. There is not a neonatologist that hangs out with them. Nurse midwives deliver babies. They also provide well woman care, so they don't necessarily just deliver babies, but you can see a nurse midwife for your annual well visits. A lot of people don't realize that. They think that nurse midwives just run around and deliver babies, but they are experts in the care of women throughout the lifespan. And also experts in care of babies up to about 6 months old. They work in birthing centers. There's a beautiful one here in Denton. They work in clinics, hospitals, physicians' offices, public health departments. Again, very similar to the other nurse practitioner routes, a year or 2 clinical experience. You'll need a DNP by the time you all are graduating, and the average salary is around $97,000 a year. Clinical nurse specialists, we mentioned before, they can work in community agencies, healthcare systems, hospitals. They are your expert go-to nurse. So if you are a BSN, and let's say you're working on a cardiac unit, you may have a clinical nurse specialist that's assigned to your unit that helps with educating you when there's a new procedure. They may help with the coordination of patient care. So they're still there close to the patients and working with nurses, but they work just at a little bit of a different level. 1 to 2 years of clinical experience in your specialty, and this is a master's degree and will probably stay a master's degree. And your average salary is around $73,000. The clinical nurse leader role is similar to the clinical nurse specialist role. This is a new role, so we don't have a whole lot of data on average salary and where people are working. MD Anderson Hospital is actually a leader in implementing this clinical nurse leader role. I almost see it as like an expert charge nurse role, where in hospitals, if you're working in a hospital, there's generally nurses that will take patients, and then there'll be a charge nurse. And that charge nurse may not take a patient load, but they help with the coordination of the care that goes on in the unit for that day. The clinical nurse leader role, I think, is trying to expand that charge nurse role, where they're giving you a little bit more education and information on how to be a leader on your unit and how to manage workflow and things like that. So that's a newer role, but that's a master's degree as well. And then nurse educators. And there's several different types of nurse educators. You can work in a hospital as a nurse educator, and you'll be responsible for keeping everybody's CPR up to date and educating nurses about new things that are happening in the hospital when you get a new home. Your education is a bachelor's degree, but you also can go back and teach with a master's or a DNP or a PhD. And generally, the more education you get, the higher level of education of nurses you're teaching. The average salary is about $63,000, so I know that looks like less than what the other salaries make for advanced practice, but remember, you usually have your summers on. So this is usually a 9-month contract, and working in the summers or working in your clinical specialty helps to augment that salary. Okay, so lots of opportunities. We're a growing profession. changes in nursing. I think you're going to see that there's just a ton of opportunity. And then I'm going to give you some advice for nursing students. Those of you that are studying for your micro exam tonight. So these are my pearls of wisdom from teaching in an undergraduate program, things that I can tell you that I have seen work from firsthand experience. One, know that all the classes in the curriculum, your prerequisites and your nursing courses, all work and they fit together to make you a professional nurse. Do not brain dump at the end of your classes. What you're learning in micro, you will apply in your nursing courses a couple of years down the road. Save your textbooks, save your notes, but you will come back to those concepts. Know that everything you're learning in your undergraduate, even in English and psychology and human development and all of those things, are all very, very important. So remember that as you're going through your classes. Even if it's a really hard class, don't brain dump it at the end. Know that you'll use it again. Learning is time consuming. What you put into a class is what you will get out. Learning in nursing is active and participatory. Just sitting back and listening to a lecture is not going to make you a great nurse. You have to be active, you have to participate. You will use auditory, visual, and kinesthetic learning. Have all of you done learning styles, testing? Do you all know what your learning style is? Who's my auditory learner? Anybody who's an auditory learner? I love to use this example. So they say, I'm an auditory learner. That's the only way I learn. No. You learn all these ways. So when I'm teaching you how to start an IV, you probably don't want me to just tell you. You want me to show you. You want me to, and then you want to do it, right? So know that in nursing, you need to use all of those ways of learning. Even if you're strong in one, pay attention and be stronger. Learn to be stronger in those other ways of learning because you'll use all of them. Nursing is a thinking and doing profession, and writing, and calculating, and communicating, and everything else. One thing I like to talk about is the Carnegie formula, which I don't think a lot of students understand. Like, how do we determine how much work we give you in a 3-credit-hour course? What makes a 3-credit-hour course? 3 credits equals 3 hours of class in school, right? 3 hours of actual in-class time. But we account for 6 hours out of class for reading, for assignments, for studying. So you should be spending, on average, including your time in the class, about 9 hours a week on a 3-credit-hour class. So if you're taking 5 classes, and they're 5 3-credit-hour classes, right? So that's 15 credits. You should be putting about 45 hours a week into your studies. And if you're not, and you're not happy with your grades, take a look at the time that you're putting into that class. You may need to do some more reading, some more studying, and pull some more things in. I think that's did anyone ever tell you about the Carnegie formula? Yeah, and how we figure those things out. So I think that's important. So, do take care of yourself and do take care of each other. I think that's really important. Nursing school is stressful. College is stressful. It's a lot of work. Time management, stress management. Try to eat right. It's so hard, but try to get those extra veggies and fruits in. It's important to sleep. Studying last minute does not help, so you need to be doing little chunks of studying along the way. Mental health and self-care. Talk to each other. Don't try to do this all by yourself. My study tips: don't procrastinate. Read a little bit for each class every single day. Schedule time in your planner for studying. Don't just write down when things are due in your planner. Schedule time. Great study that came out this summer. Take notes by hand. You will learn more in class if you take notes by hand than you will typing them in. Long story as to why that is, just trust me. Try that. Take notes by hand in one class and see if you think you remember more than the class that you took notes on the computer. Outlining your text is not a great way to learn. There's some good research out on this, that by the time you're really awesome at outlining, you're just outlining. you're really not learning. One of the best things to do is to read small sections of your textbooks or your notes, close them, and summarize it. Either verbally out loud or write it down. That's a better way to learn than outlining. The other thing I can't stress enough is to form study groups. Peer-to-peer learning is really important. In the undergraduate classes that I taught at Baylor, when I had students that would do really well in a course, get a real solid A, I'd say, what did you do? How did you do really well in this class? Tell me what it was that you did. And almost all of them will say, it was my study group. And we would get together a couple of hours the day before the test, and so, I always got 2 or 3 more questions right because I didn't focus on that, but she did. And she was able to say, okay guys, remember this, this, and this. And I always got 2 or 3 more questions right on the test. Well, 2 or 3 more questions right on the test can be a big difference, right? So study groups are great. Write test questions from the material and quiz each other. What do you think the teacher's going to test you on? Write some test questions. If you get a group of 4 people together, all write 5 test questions and quiz each other. You might be surprised you'll see them on the test. Assign a person in your group to become an expert at one of the objectives or one of the lectures. So they do all the reading on one section and then they come back and teach it to you. These are great, great, great ways to learn that students all the time say helps increase their grades, particularly doing better. One of the last slides is trust your faculty. Know that we're here to help you. Don't wait until you're in a big hole and you don't think you'll be able to get out to come and talk to us. We are here to help. We want you to succeed. I think sometimes students, and it's pretty easy by about mid-semester to look at your professor and say, you just want half of us to fail. I just know you do. We really don't. We want you to succeed. One of my favorite quotes from one of my favorite education books says, learning is hard and messy work. It is. It's challenging. We can't do the learning for you, but we're at your side to help you. Communicate with your professors. If things come up in the middle of the semester, you have death in the family, there's an illness, we can't help you if we don't know what's going on. And don't be afraid to email. I got an email yesterday from a student who said, can I have an extra day on this written assignment because I've got to go help take care of my aunt? Of course you can. So, but communicate. If I don't know it ahead of time, I can't help you and I can't make those changes. So most of the time when students communicate with your professors, you'll be pleased at what your outcome is. Be reasonable. Not everybody can get an A in every single class, right? It's not going to happen for most of you. It's okay. It's okay to get a B every now and then. Just learn. Learn from what you miss. Learn from what you don't do well on. But know that an A, I would tell you, the very best nurses that I've ever worked with did not necessarily have the highest GPAs in college, but they were willing to learn and they were willing to learn from their mistakes, and that's what's most important. Love your profession. You will define yourself as a nurse. When you become a nurse, when people say who you are, when you think of yourself and you think, well, I'm a mom, I'm a sister, I'm a wife, I'm a this, nurse will be one of the first things that you'll add right in with that. It becomes part of your identity and who you are. I don't think most accountants would say, but nurses say, I'm a nurse. And we're the most trusted profession. Time and time again, there's surveys that go out. So know that you'll be trusted and know that that is a privilege. It's a privilege to be trusted by your patients and by the community. And that's truly a gift. Be confident that you will be successful. I know probably it's hard. Getting ready for this micro test. Be confident. You're going to pass. It's going to be okay. And go make history. It's your future. Questions? What can I answer for you? Yes.
If you have a bachelor's degree in like another field like health science or health studies, can you also apply to the...
Yeah, you can. Definitely. There are a lot of students through TWU that will apply. They maybe got their bachelor's degree someplace else, or they did their prerequisite courses someplace else, and they'll apply at that same time and to apply to get into school. There are also here's the weekend program here. actually within the state that even if you have a bachelor's in another field, once you've completed all your prerequisites, you can do your bachelor's in one field. Yes.
Let's just say, God forbid, that you just don't get into the nursing school that you apply to. What do you do if you finish all your prerequisites and you feel like you've done good enough, not to just go back and try to take the course over you when you pretty much feel like you've done your best, and what do you do in that time span and waiting to go to nursing school?
It's a tough question. It's a tough question. This program is very competitive. The fact that you're sitting in this room and you're going to complete your prerequisites here at TWU is a good thing. Okay? The minimum GPA to be admitted into the program is a 3.0, but you want to shoot for about a 3.5. And that's just the way it is. It's a competitive program. You do have an advantage over people coming from the outside taking your courses here. That is a good thing. If you don't make it in, there's a lot of other programs. Just like you said, can you get your bachelor's or your prerequisite someplace else and go to another college? Yes, you can. And there are schools that have lower GPA requirements. All schools look at admission differently. Ours is very lockstep. It's all about the numbers. It's the TEAS test that you'll take along with your GPA, and literally it just spits out the numbers. It doesn't have anything to do with how many community service projects you do or any of that. It has to do with all the numbers. So focus on your schoolwork.
And so with the test, do you have to take that for every school you apply to, or just one general test and then the scores go out to all of them?
The scores will go out to different schools will accept different tests. The TEAS test is here. I know there's a HESI test that some other schools will take as well. So you really have to look at the individual schools, what their requirements are, and that'll tell you. But yes, if you took the TEAS here and you applied someplace else and they also looked at the TEAS scores, then that would count. Most definitely. Yes, ma'am.
So do you recommend internships in nursing?
Once you're in the nursing school, yeah, I think it's great. You will have an internship at the end. You will be placed. You'll do a capstone type where you're in the hospital with the nurse. It's usually your last course. We actually have the gentleman here that places students in their internship program. So, but there are a lot of opportunities to work as a patient care technician in hospitals. It's a good experience, but you need to limit your hours. We usually will say maybe 10 hours a week, max. We would recommend working outside of your schoolwork. So, yes.
How do you study for the TEAS exam?
I think there's, the advisors will help you quite a bit with that as you are moving in that direction. I think, are there review courses for
Commercial study guides that you can purchase. All of the big publishing houses, Barron's, do those study guides. And the most important thing you can do to prepare for TEAS is take the practice tests and pay attention in the classes you're taking now, because it's all stuff that's going to appear on.
That plays into the no brain dump, right? That's hard to do sometimes. Yes.
Do TW offer the TEAS test? Because the school I was coming from, we do take the TEAS test. So it's part of the TW.
No, there's testing centers, right? So, but there are testing centers around the area that you'll sign up for and take. So you'll go and you'll take it at a center. I'm sure there's some in Denver. Yeah.
So if you go to a doctor program for like a certain area, like I want to do nurse practitioner, and I want to go back and teach later on, would I have to get a different certification, or would I just use?
Nope. As a DNP, you can be hired into a university setting. Most certainly, for teaching. Yes.
You said there was a BSN to PhD program. Are there programs that are like BSN to PhD?
Well, that is essentially what
Oh,
the program becomes. It is a BSN to a DNP. So you'll be admitted right into that DNP program and plan on 3 to 5 years of education. I've seen curriculums that they try to squash it all into 3, and I've seen some curriculums where they'll extend it out over 5. That's full-time coursework. If you go part-time, obviously it'll take longer than that. And there are a lot of nurses who go back to school and work many, many years. You don't have to go back to school immediately for 5 years right after you're done. You can work and go to those and go into a DNP program. Yes. Yes. Yes, ma'am. We do. Other questions? excited? Yeah. That's good stuff. Do you want to say anything about the careers and boot camp that's this week? Will they be participating in that at all?
I don't know very much about what's going on. Are you all doing any of the boot camp stuff? Yeah, and you can go to the College of Nursing website and look for, and there's also a Facebook page. So, lots of fun stuff with boot camp, and it's really good.
Lots of fun, and they'll give you lots more information about the program and things like that as well. Well, thank you all very much for coming, and we'll look forward to seeing you.
And before you all leave,